Welcome to Balanced Beauty Talks, the podcast where we redefine skin health through a holistic lens.
I'm Natasha, an esthetician and nutritional practitioner passionate about helping you nourish your skin from the inside out.
I'm Dr. Khadija, an esthetician and naturopathic doctor here to explore the natural pathways to radiant skin.
And I'm Alicia, an esthetician and skincare enthusiast. Together, we're diving deep into the world of aesthetics, merging modern treatments with internal wellness so you can achieve long-lasting results without compromising your health.
Whether you're a seasoned professional looking to elevate your practice or someone seeking effective solutions for conditions like acne, you're in the right place.
Join us as we share expert insights, inspiring stories, and practical tips that empower you to embrace a truly balanced approach to beauty.
So get cozy and prepare to transform the way you think about skincare.
Welcome to Balanced Beauty Talks.
Please note that the information provided in this podcast is intended for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast. Your health and well-being are important, and we encourage you to make informed decisions.
Today, we're diving deep into one of the most talked about skincare ingredients out there, retinol. We'll be breaking it all down, how retinol works, its benefits, the retinol purge, how to use it the right way, and whether natural alternatives can actually compare. So if you've ever been confused about retinol, stick around. This episode is packed with everything you need to know about this ingredient. So retinol is one of the most talked about skincare ingredients. Why do you think it has such a strong reputation, or why is it talked about so much?
I think one thing that creates a lot of controversy and conversation around it is the fact that there is both prescription and over-the-counter. So you have a little bit of a battle in those two worlds, and which one's better, which one's better for certain conditions. Yeah. So I think that's probably one of the reasons why it's really talked about, and there's a little bit of conflict with it.
Yeah, and I think because it's such a powerhouse and it does a few things and it's very active and effective, there's lots of buzz around it. When we look at skincare and what we quote our ABCs of skincare, retinol's up there.
Yeah.
It's one of the more important ingredients to be using for prevention and correction in skincare. So I think because it's such a powerhouse, it definitely is something that's talked a lot about.
Yeah, it can be used for such a wide scope of things like acne and for anti-aging purposes. So.
Yeah, I think anytime there's an ingredient that falls under anti-aging, it tends to get a lot of attention.
Also, vitamin A in general can also get a bit of a bad rep because of Accutane and some of the thoughts around that. So yeah, it can be controversial too.
Yeah.
Well, okay, so can you break down the differences between retinol, retinaldehyde, and prescription retinoic acid?
Yeah, so essentially it's just how our skin is converting that form of vitamin A. So the most usable, where there's no conversion necessary, would be retinoic acid. So tretinoin, that's a prescription strength retinoid. And then we move into retinaldehyde, so retinol, which has one conversion, retinol, which has two conversions, a little bit slower. And then lastly would be retinol esters, which have three conversions. So just slower release form of that vitamin A.
Retinoic acid is the available form. That is what your body requires to be able to make use of that vitamin A. So that's why there are these different steps before, because you have to convert it into retinoic acid to be able to use that retinoid.
Right. What would you say is the biggest difference between over-the-counter and prescription strength retinoids?
Well, I think besides the obvious conversion of how our skin is accepting and converting that into retinoic acid, we look at things like the formulation. So when we're using a retinol, for instance, those are typically microencapsulated, which means that they're time released to work with our circadian rhythm, and they're being released into our skin while we sleep. So retinol is something we use at night. So those actives are being slowly released into the skin as we're sleeping. And then we look at the other parts of those formulations, which will typically be things like hyaluronic acid, which is a humectant, niacinamide, which is really great for the barrier of the skin. So they're a little bit more conditioning and barrier friendly to the skin. And because of that microencapsulation and that slow release of the product, it just makes it a little bit more gentle on the skin, less active and irritating.
So why is it that people love it so much for anti-aging skincare?
The reason why retinol is considered the gold standard is because of the delivery system. So really it's being delivered deep enough into the skin to stimulate fibroblast activity which is responsible for activating our collagen and elastin stores. So when we look at aging, we want all of that collagen. That's what really the goal is, to once we hit 25 to 30 and we're no longer actively making collagen on our own, we're looking for all of these magical little tips and tricks and actives that kind of are delivered deep enough to sort of stimulate that collagen, elastin, and retinol really is the gold standard for that.
And what about for acne? Why do we love it so much for acne?
Well, with acne, one of the components that contributes to acne is this overproduction or retention of skin cells in the pore. And retinol can increase that cell turnover and help kind of push those dead skin cells out of the pore. So it helps reduce some of the congestion that is occurring deeper in the pore. But then also, just like going back to anti-aging, if it is stimulating collagen and helping with the skin barrier, you're also going to get the support that way with healing the skin.
Yeah.
And it can also help with the hyperpigmentation that acne leaves behind. So it kills a few birds with one stone.
I think an important thing to understand about retinol too, this is a good time to talk about skin cycling. So what that means is that you're using a retinoid a few times a week, hopefully not on consecutive days. So we like to say like Monday, Wednesday, and Friday. And in between those days, we're using an alpha hydroxy acid. Because retinol is increasing our cell turnover so rapidly, it's pushing all of those dead skin cells up to the surface. So it's stimulating fibroblast cells, collagen. It's moving all of those dead skin cells out of the pore up to the surface of the skin, but it won't actually remove it from the surface of the skin, which will start to just make the skin appear really dull, ruddy, and kind of lifeless. Like you'll really start to lack that glow. And it can also cause a little bit of congestion under the skin too when you have such a buildup of dead skin cells. So a nice thing to do is incorporate an alpha hydroxy acid, which are larger molecules than a beta hydroxy acid. And they sit on the surface of the skin and they essentially just eat away at those dead skin cells. So one night with the retinol, let's just say Monday, Wednesday, and Friday, you're using your retinol. Tuesday, Thursday, Saturday, you're using an alpha hydroxy acid. So one night with the retinol, you're pushing everything up to the surface of the skin. The following night, you're kind of sweeping or eating away all those dead skin cells. That will allow your skin to absorb your topical serums a little bit better. You'll have a nicer glow, you'll have less congestion, and then you're going to see that the skin has a brighter appearance. So when we're looking at things like hyperpigmentation, that's when those things really start to like click together and work in synchronicity to start to remove some of the pigment a little bit quicker, brighten the skin, and you're going to really start to see the results of your retinol versus using it every night. That can just be really difficult on the barrier of the skin.
I love that.
Yeah, that's great. We often hear people talking about the retinol purge. So what exactly is happening with the retinol purge? What is that? And how do people kind of prepare for that?
The retinol purge is really just because we've sped up cell turnover. And so it's bringing everything that's underneath in the pores up and out. And so you have to experience that to essentially deep clean the skin and go through that uncomfortable stage. It's also just like it's new to the skin. And anybody who is acne prone, as soon as you introduce something new, it tends to respond a little differently. And so it's just allowing the skin some time to really adjust, clean itself out, and start to regulate itself properly.
Yeah. I think when we see patients who are experiencing that for a really long period of time, then we have to start to look at what are you using? What is the type of vitamin A that you're using on your skin? If it is a prescription, because there is no conversion in the skin, and again, we talked about those formulations where they're not as gentle on the skin, they're not as hydrating to the barrier. Sometimes with acne, we have a very compromised barrier. So we require those things to kind of offset a very active product like vitamin A. So that may just mean the prescription, your skin cannot tolerate it at the moment. Maybe at some point, fantastic if it does. If not, maybe dropping down to a retinol is the better option. Just going with a lower percentage and doing that slow integration. Sometimes that's what you need to kind of get over that hump because that prescription can just be a little bit too aggressive on the barrier and cause purging for really long periods of time. I think we've seen that with a lot of patients. They'll be quick to go to their doctor and get that prescription, but their skin is not really in the shape to tolerate that level of vitamin A.
So what do you think is a safe timeline for purging to know if it's been ongoing for too long?
Well, a little bit of a loaded question. I think it depends on how frequently are they using it. So those are some of the things we need to look at when we look at retinoids. It's like, how frequently are you using this product? What are you using it with? Are you putting on a moisturizer? Are you not putting on a moisturizer? What's the percentage of that topical? So we need to first look at all of those kind of components. If they all feel like they're within that suitable range, then we know that if we're going low and slow with the integration of a retinol, which we'll also talk about how to integrate that into your routine, it can take up to 7 weeks to really do the full integration. So I think by, 10 to 12 weeks, if you're still experiencing a ton of purging, we need to look at like the formulation of that product and maybe percentage and
Yeah.
switching or
Finding what's right for you.
finding what works better for you. Yeah.
So if someone is new to retinol, where should they start?
My favorite place to start if they're coming into our clinic would be low and slow. So typically our retinols start at a 0.25 or a zero point 0.3, just depending on the line. And then that integration, for me personally, I like to say the first 1 to 3 weeks, Monday night, 4 to 6 weeks, Monday, Wednesday, 7 and beyond, Monday, Wednesday, Friday, and then alternating with an alpha hydroxy acid. If you're not already using an alpha hydroxy acid, maybe that's a good place to start, especially if your skin's a little bit more sensitive. So even incorporating an alpha hydroxy acid into your skincare routine 2 to 3 times a week for 4 to 6 weeks, and then we start to slowly integrate a low dose of retinol.
And if you're really sensitive and you really want to start slow, you could always start with the sandwich method as well, which is moisturizer, retinol, moisturizer,
Yeah.
and kind of add a bit of a buffer.
Yeah. Because typically what you're doing is you're cleansing your skin first. You want to make sure your skin is completely dry after that. And then the retinol is the next step. So yeah, if you are sensitive, that's when you would do the moisturizer right after your cleanser, retinol and moisturizer. Or if you're not doing that, then it would be cleanser, retinol, moisturizer.
Yeah. And this is like a place where there's a lot of products that you can just kind of apply a little bit more haphazard and you don't have to think too much about it. Retinol is not one of those products. So you're really avoiding and leaving like to call like a nice panda circle around the eyes. And I like to put it on the back of my hand and I'll dot it onto the places of my face. That allows you not to, again, product load. When we apply things, we tend to go like nose and work outward, like medial to lateral in the face. If you dot it onto the face and you rub it in, you're getting a nice even application, dry skin. And then sometimes I'll even take like a Q-tip and go right in the corners of my nose where product tends to pool, because that's an area I think we've seen lots of patients. They come in, especially in the winter, and the corners of their nose is always peeling. So if that's you, just take a little Q-tip and like just kind of wipe it out and dry that area. And then, yeah, just make sure there are retinols that are formulated for the eye. There are retinols that are formulated for the neck. So jaw up and then avoiding that eye area. And then, yeah, if you tend to get dry in and around your nose, just give it a little wipe with like a dry Q-tip.
Okay, so let's talk a little bit about ingredients that we love to pair with retinol, which ones we want to avoid combining.
Well, I think when it comes to good or kind of like BFFs of retinol, let's say that, while you're applying a retinol, so things like peptides. When we look at especially collagen stimulating peptides, retinol allow those products to get a deeper delivery into the skin. Love a good peptide serum on top of a retinoid. Again, sandwich method if your skin tends to be dry and a little bit more sensitive. Things like hyaluronic acid, so a humectant that's going to bring nice drink of water for the skin, really rehydrate the skin. Niacinamide, great for the barrier of the skin. This is a really good time if you suffer from hyperpigmentation or melasma and your skin is tolerating your retinol really well. This is where you will put on your brightening product. Again, deeper delivery of that product and just more efficacy with those products. So, yeah.
Another big important thing to remember is the time of application is always only at nighttime, because it is not something you want to be out in the sun with. You will cause major photosensitivity. So sunscreen has got to be worn in the mornings when you're using retinol. Well, every day, but most especially when you're using retinol.
Yeah. Another one that work opposite in the routine, still, I like to say like BFS, just not at the same time, vitamin C. So vitamin C is integral for collagen synthesis. So as retinol is stimulating our production of collagen, vitamin C is actually the part of our skincare routine and collagen synthesis that helps us hang on to that collagen. Equally as important, if you're using a retinoid, you need to be using a vitamin C.
Another active that we really want to avoid when we're using retinol in the same use would be benzoyl peroxide or salicylic acid. Truthfully, any acne exfoliators would want to be avoided. They will interact with each other and could cause a lot more inflammation and sensitivity in the skin.
So some people believe that retinol thins the skin. Is that true or is this a myth?
Actually, retinol does the complete opposite. Because it's stimulating collagen, it actually will thicken and improve the overall integrity of the skin entirely. So definitely a myth.
Yeah.
Okay. Okay, so what would you say is a good age to start bringing retinol into your routine?
Yeah. I think that really depends on your skin concern. If your skin concern is acne, then the age is not, we're not necessarily using that for promotion of new collagen and anti-aging. That's more for decreasing the amount of keratin buildup inside of a pore. So that's a little different. That can be, teen years, as long as your barrier is kind of intact and your skin is not too dry. When it comes to anti-aging, however, I would say like 25 is a good place to start. I think 25, we start to really see our collagen stores degrade and reduce. So anything we can do to be preventative, as we know when it comes to skincare, preventative is always so much easier and less expensive than corrective. So as we start to slow down our collagen production, I think it's a great time to just kind of keep it active and kickstart that collagen continuously. So, yeah.
Awesome. Okay, so is there any forms of natural retinols or vitamin A that we could use topically?
Yes, there is something called bakuchiol, which is a plant-based ingredient and is a natural alternative to retinol. So it doesn't convert into retinoic acid, but it activates the similar pathways in the skin, which will promote collagen production and improve the skin texture. So this makes it a safe alternative for women who are pregnant or breastfeeding that have had to stop Botox or just neuromodulators, stop their retinol use. And then they're like, oh my gosh, like pregnancy is 9 to 10 months, we'll say breastfeeding, the panic sets in. How am I going to prevent aging? Also, talk about lack of sleep. So all of these things are accelerating the aging process. So what is something that someone who is pregnant can do? They can use bakuchiol.
It also might be a good alternative for those who are really photosensitive to the sun and don't like to maintain retinol use throughout those summer months. Could be a great alternative to kind of maintain the work that they've done with their vitamin A therapies or retinols. It doesn't increase sun sensitivity.
Yeah. It also will not increase our cell turnover. So this is not an alternative for someone who is younger and looking for an alternative to retinol to help with the cell turnover when it comes to acne. It's not going to do that. And usually when I've seen bakuchiol, it's always formulated in an oil base or typically with an oil. So again, not necessarily the best formulation for someone who is acne prone, but if you're looking for a more gentle alternative to anti-aging, this could be a good ingredient.
Totally.
Yeah. I think most of the studies that have been done on it are also under the anti-aging umbrella. I don't think that they've done too much with the acne side of things. So the comparison is really like the effect on fine lines and wrinkles when you're comparing retinol and bakuchiol. So since we take obviously a holistic approach here, what would you say internally are some sources of vitamin A, or how can we support the same kind of process internally through food and nutrients?
First, I would just like to say that supplementing with vitamin A outside of just like your regular multivitamins is definitely not something you want to be doing on your own. It can be really easy to overdose on vitamin A, and it is something that you want to work together with a practitioner to be monitored. So vitamin A through supplementation is just not the best choice if you're not working with somebody. Food-wise, though, there's plenty of bioavailable foods that you can eat to help incorporate higher vitamin A levels to have similar effects on the skin. You can find them through liver if you're into that. Eggs are really high in vitamin A. Some dairy products are really high in vitamin A. But first and foremost, your bright red, yellow, and orange vegetables. So you're getting that vitamin A. You're also getting that antioxidant support. Those are just a really great way to have vitamin A in your diet. And yeah, I always say try to eat the rainbow. What is one key thing that you wish everyone knew before starting retinol?
Well, I would say one key takeaway that I have kind of with retinol would be consistency. I think consistency is key. And I know that that can be really hard when your skin is purging or feeling a little bit irritated. Again, as we've talked about, there's so many factors when it comes to choosing the best option for you, but you need to be consistent. If you're using it once a week for a year, It's enough to just make your skin a bit irritated and not ever really reap the benefits of a retinoid. So I think consistency for me is probably the
Okay.
one takeaway I would have with retinol.
Be patient, start
Yeah.
slow, and always wear SPF.
Yes.
Sorry, something else I was going to say is retinol is one of the products that I really, really kind of want people to be working with a practitioner with, having a medical grade product, because everything we talked about, working through the purge and understanding how your skin is responding to it and whether it's the right potency for your skin, that is really hard to do on your own. And there are so many ingredients and products out there. And when you start messing around with retinol, it can be very confusing and can be very hard on your skin. So I feel like just sticking to medical grade, especially for retinol, and then working with a practitioner is super important.
Yeah, I agree because there are so many products on the shelf that do not even list the percentage of
Yeah.
that active. So people will come in here with retinoids that no clue how strong it is.
Yeah.
Like there's so many variables to a retinol. Again, it's not something to start when you're starting a whole new skin routine and you're starting everything that same day. We don't know where you're reacting. There's a process to it, and it is for sure a bit of a journey that requires, I think, some professional guidance, in my opinion. Too.
Yeah.
Yeah.
Retinol burns are a real thing too. We see a lot of those. So
Yeah.
yeah.
I think another thing to note too, we do send out pre and post care to all of our clients. However, we get asked a lot, when should I start my retinol again? When should I stop using my retinol? You always want to consult with your practitioner, depending on what you're doing. But a good rule of thumb for a facial is probably about 5 days pre-facial. If you're doing something more invasive, like a resurfacing, I would say aim for 7 days. And then post, that's really dependent on what you're doing. If we're doing laser resurfacing, that can be 2 weeks or even longer, depending on how sensitive your skin is. So there's a lot that goes into that, but as a good rule of thumb, 5 days before a facial, you want to stop using your retinol.
Okay, well, that's it for this episode. We are going to transition into our Ask an SD segment. We have a question here, and I think this one's for you, Dr. Khadija. We have someone asking, what would you recommend as a supplement for anti-aging?
I think for anti-aging, I would probably focus on antioxidants because that's what's going to be fighting that free radical damage. So a supplement that I really like is like if you can get a combination of antioxidants, I feel like that's the best because they kind of support each other in terms of absorption and action in the body. So there's a supplement I like that's called ACEs and Zinc. It's basically vitamin A, vitamin C, vitamin E, selenium, and zinc. And all of those work really closely together and they can have an impact on other things in the body. But in terms of anti-aging, I feel like that's like your biggest free radical fighter.
Really, I love that supplement.
Yeah.
Okay, that's it for today, everybody. Thanks for listening, and we'll see you next time.